Welcome to Nursing Guru. Let's discuss about anemia. It's a topic in adult health nursing. What happens when a patient has anemia? So here, when a patient has anemia, the blood carrying capacity of oxygen, it decreases, and our body tissues, it gets very less oxygen due to anemia. Okay, so we have discussed regarding the definition. Let's move on towards the pathophysiology of anemia. Okay, so first thing is there is a less count of RBC, hemoglobin and hematocrit values. Due to this, there is a decreased capacity of oxygen carrying to the body tissues, and next here what happens, due to that our body tissues cannot be able to function properly. Due to that we will see the signs and symptoms like fatigue, tiredness, breathlessness, rapid heart rate. Okay, this is the pathophysiology of iron deficiency anemia. Next, let's see about the normal values of this hemoglobin. Okay, so in men we need 13 gram per dl and in women we need 12 gram per dl. This is the normal level you need. If it decreases, then we call it as anemia. Next, let's move on to classification. There are 6 types of anemia. So first one is iron deficiency anemia, second one is megaloblastic anemia, third one is hemolytic anemia, fourth one is hemorrhagic anemia, fifth one is pernicious anemia, sixth one is aplastic anemia. So first let's discuss regarding the iron deficiency anemia. Iron deficiency anemia mainly occurs due to loss of iron, and it is especially seen in women due to menstrual blood loss. Second one is megaloblastic anemia. This is seen especially due to the vitamin B12 deficiency. Next, third one is hemolytic anemia. This occurs due to the rupture of RBCs, especially due to the parasites, toxins. These are the causes for this. Next one is hemorrhagic anemia. This is due to the excessive loss of RBCs due to the bleeding because of some disorders like stomach ulcers and bleeding of GI. Next one is pernicious anemia. So here the thing is we cannot absorb the iron from our food, especially in the small intestine. The last one is aplastic anemia. So here the destruction happens due to the medicine, especially like radiation and cancer medicines. Next, let's see regarding the causes. The first cause is poor socio-economic status. Due to the poor economic socio-status, here the people won't get the proper iron-rich food. Due to this, it may lead to anemia. Second one is multiparity. Especially women bearing pregnancy again and again, due to the blood loss, it may lead to anemia. Then the third part is mainly parasitic infections. Due to hookworm, tapeworm, all these infections, it may lead to anemia. Next, let's move towards the symptoms. What happens when we get anemia? What you feel every day in your life? The first thing is fatigue. You feel very tired. You cannot able to do day-to-day activities and you feel exhausted very fastly. So this is the main symptom. The second thing is you may get dizziness, then you may faint, then you cannot able to perform like huge exercise activities. Okay, very low performance, then your skin will be very pale and very dry, and the hemoglobin levels will be very low. Then your blood pressure will be very low and you will always feel palpitations when you do excessive activities. Then unusually you will have a rapid heart rate. These all are the symptoms of anemia. Next, let's move towards the investigations. What you need to do. Especially you need to do the blood test. In blood test you need to check the hemoglobin, then RBC, then packed cell volume. All these things you need to check to know whether you have anemia or not. After doing this you can go for the management. So how you are going to manage it? You can manage it with the drugs, that is pharmacological management. You can manage it with the diet. First let's see regarding the pharmacological management. So here mainly you need to take iron tablets. What are those? First is ferrous sulfate, then second one is folic acid. Then what you need to take along with that? Vitamin C. It is very important to take vitamin C along with the iron tablets. What is the reason? The main reason is you need vitamin C to get the iron absorbed into your body. So it is very essential to take iron tablets and vitamin C togetherly. Next, let's move towards the diet. So what you need to follow every day? So if you are a coffee lover, you need to stop the coffee and chai. Why you need to stop it? Because it will inhibit the absorption of iron into your body. Next, what you have to do? You need to eat the vegetables which are high in iron rich. Okay. So first thing is spinach, then red beans, then you can take some meat also. So which meat you need to consider? So mainly the thing is mutton liver or chicken liver. So those things you can choose to get more iron from that. And don't forget to take vitamin C along with that. If you do not want to take vitamin C tablets, you can go for the citric fruits which contains vitamin C in it. This is the diet you need to follow. Then you need to control the parasites. So how do you control the parasites? You can take albendazole tablets single dose. You need to take at night and you need to sleep. Even for children it is very necessary to give albendazole tablet at least for once in a 6 month. So today we have discussed regarding anemia. I hope you understood. You can watch again and again in our YouTube channel Nursing Guru. Thank you.